So I'm happy today. I'm honored to be here and to be able to discuss with you, to have a great discussion about this amazing, intriguing, and surprising and unpredictable substance or plant called cannabis. I think you've all heard about cannabis, right? Anybody never heard of the word cannabis? Or marijuana or pot? No, everybody has probably, everybody heard about this substance, and some of you have certainly tried it, and you can share your experiences, but not here, not today. Okay, there is a problem. It's jumping on the last. Yeah, there is a, sorry, it's technical problem again.
Try an arrow key.
Huh?
Try an arrow key.
Yeah, that's what I'm trying. And it's taking me to yeah. Yeah, it's going to the light slide.
You're on the last slide. You have to go all the way up to the top. There you go.
Ah. Because the last slide looks like the first slide. That's probably the problem. Okay, good. All right, so teamwork. So as Hippocrates said, science is the father of knowledge, but opinion breeds ignorance. Today we're not going to be talking about opinions. We're going to be talking about the little bit of science that we know about cannabis. I always like to start my presentations by this statement that what we know in science is always so little compared to what we don't know. So it's important to keep that in mind because it's beautiful. It's beautiful that we don't know everything. Otherwise, why would we be here? Why would we have colleges and universities? So it's beautiful not to know everything because it stimulates our brain and encourages us to learn more. That's why we have dedicated faculty, dedicated students who are always learning to push farther and higher the knowledge that we have today. And today we are going to discuss about cannabis with that in mind, that we do not know everything about cannabis. I cannot stand here and say I am an expert and I know everything about cannabis. It will be a misstatement. We are at the embryonic phase of learning about cannabis. So today we are going to discuss about how do we identify or understand the endocannabinoid system and different chemical components found in cannabis and how they positively or negatively affect the human body. We're trying to understand the risks of cannabis usage for adolescents, young adults, and adults. And we will explore together the myths and reality surrounding recreational and medicinal cannabis usage. You can see these two guys trying to smoking their joint. And hey, we should totally move to Canada. And the other one, dude, we're already in Canada. Why do we need to talk about cannabis? Anybody wants to? Yes.
There's a lot of stigma that surround it.
Excellent answer. Anybody else?
Educate the community.
Educate the community. Anybody else? Excellent. All the answers are good. Some possible cures. Excellent. So we need to talk about this substance because it matters. It matters because 1 in 7 or 14% of Americans claim to have used cannabis in the past year, according to the study. And 8.7% claim they had used the drug in the past 30 years. This is a significant number of people. It matters to talk about it because in Canada, it's comparable. 17% of Canadians 15 years and older claim to have used cannabis in the last 3 months. Here in Florida, as you can see right here on my left, it's tobacco smoking versus marijuana smoking among high school students and middle school students. You can see that in the last 10 years, tobacco use has sharply decreased, while cannabis usage is stable or has increased. This is an important message. So when some people say, oh, cannabis has not increased, even though some states have legalized, you can compare that tobacco smoking, because of the campaigns, has decreased significantly, but cannabis has not. So this is significant. And when we talk about the US, you can see that about 8% of people in the US versus 7.6% in Florida are using cannabis. You can see the slight increase in the last 10 years probably reflects the larger portion of midlife and older adults who have begun using cannabis in the last 10 years. The main message on this slide is that usage among teenagers and those under the age of 24 is 2 to 3 times higher than adults. So it is very important. It matters to understand this substance because our young people are using the substance in large numbers. This is a study done in Canada last year, between 2017 and 2018, evaluating how many young people are hospitalized and why. Found out that 1 out of 20 hospitalizations for those between 10 and 24 years is related to substance abuses. And I'm going to ask you a question to keep you awake. Which substance is the most commonly associated with those hospitalizations for our young people, according to you? Who say alcohol? Ah, you guys are good. Who say LSD? No. Who say crystal meth? Who say cannabis? Who say heroin? No. Who say cocaine? Nobody. Oh, and the answer is cannabis. Surprisingly. Yeah. So it's surprising when I read the study as well. Everybody was surprised, even the people who conducted the studies, because in college there is a lot of drinking. You know, almost 80% of college students on campus will drink a little bit more than necessary sometime in their 4 years of training. But hospitalizations were mostly associated with cannabis. 40% of those hospitalizations were associated with cannabis. So a distant second was alcohol. It was not even very, very, very close. So it's important to point out this message because young brains seem to be highly vulnerable to cannabis, probably even more vulnerable to cannabis than to alcohol. We don't know why. The cost of to the economy of substance abuses or dependence is $74 billion per year. In Canada, it's about 44 billions, but we are just 35 millions in Canada. You are 350, I think, million. So, in terms of work days lost to disability, hospitalization, rehab centers, absenteeism, criminality, detention cost. So it costs a lot of money to the economy, the substance abuse problem. So what is cannabis? This is the main question. This is why we're here today. So cannabis, pot, marijuana, weed, herb. So there are about 1,000 slang names out there. It's the most commonly used substance after alcohol and tobacco if we exclude caffeine, because it's also a substance. So it's used, documented thousands and thousands of years ago, by Chinese emperors, ancient Greeks, Romans, Egyptians. It's been used for spiritual purposes, medicinal purposes, and recreational purposes throughout the last probably 10,000 years. It's a flowering plant. It has about 500 chemical components. And among those components, there is a group called cannabinoids. There is about 100 cannabinoids in cannabis. Cannabinoids are components that have the ability to stimulate the cannabinoid receptors that already exist in each and every one here. They mimic or disrupt the endogenous system. So, two main endocannabinoids are THC and CBD. So THC is delta-9 tetrahydrocannabinol. CBD is cannabidiol. These are two main cannabinoids found in cannabis, but we have other cannabinoids less known, like CBN, CBG, that we don't really know very well. So the two main cannabinoids properties, the THC is the psychoactive ingredient in cannabis, or mind-altering ingredient in cannabis, while CBD is not really mind-altering or psychoactive. It has analgesic properties, anti-emetic properties, and appetite-stimulating properties, while CBD has anti-epileptic properties. You've all heard probably about the children who suffer from treatment-resistant epilepsy, who have benefited from CBD, CBD oil. So CBD has a known anti-epileptic property and anti-inflammatory, neuroprotective, and even antipsychotic properties. That's why in the past, when we used to have more CBD in cannabis, people were less psychotic, because THC increases the risk of psychosis, while CBD protects against psychosis. But the CBD, nobody is taking CBD for recreational use because it doesn't get you high. So the dealers or the pushers or the chemists have reduced significantly the CBD and increased THC in cannabis that we find today. Just by comparison, in the 1970s, we had about 2%. The THC percentage in cannabis was about 2 to 4%. Nowadays, it's about 15-20% of THC. So you understand why people who used to take cannabis back in the 70s, when they try it now, they are like, no, this is not what we used to take. It's completely different than what they had back then. We have different species. This is not very important to talk about it. You've heard about hemp, which is not cannabis. It's a plant belonging to the large family of Cannabisaceae. Unlike cannabis, it contains almost no THC. So it's mainly used for industrial purposes such as clothing, industry, food, paper, and so forth. So what is endocannabinoid system? Anybody? Ever heard of that? Anybody ever heard of endocannabinoid system? No?
It's in your brain. Isn't it the receptors in your brain, how isn't that part of the system that absorbs the cannabinoids?
Yes, that's good. That's good. Anybody else? Okay. So endocannabinoid system is a system that we all have. We all have, every human, every mammal, and other animals have what we call endocannabinoid system. And it's a system that is designed to keep the balance. It is designed to respond to external stimulation and to internal stimulation. And it is comprised of cannabinoid receptors, endogenous cannabinoids, or endocannabinoids, and enzymes and proteins responsible for their biosynthesis and degradation. So the picture here is just to show you how they are synthesized. You see in endocannabinoids are synthesized in the postsynaptic neurons. There is a stimulus that is going to send signals to the postsynaptic neuron, which is going to synthesize endocannabinoids, which are going to bind to CB1 receptor or CB2 receptor of presynaptic neuron to try to respond to the stressor or to the stimulation, depending on which stimulation that we have. We'll go through it in a little bit. So the endocannabinoid system has, as we said, many endocannabinoids. Endocannabinoids, the most common endocannabinoids that we know are anandamide and 2-AG. These are the main endocannabinoids that we have. And they bind to receptors CB1 and CB2. These are very important. Anandamide and 2-AG are the main endogenous cannabinoids or endocannabinoids, and they bind to CB1 receptor or cannabinoid receptor 1, cannabinoid receptor 2. There are other cannabinoid receptors which are less known and less active, like TRVP1, TRVP2, and so forth. This system is present since the embryonic stage of development. Since the 5th week of your fetal life, endocannabinoid system starts to develop. And in the beginning, it participates in development and well-functioning of your nervous system and your immune system. So it helps in the formation of synapses and in the pruning of synapses. So it is a very important system that we don't have in the textbooks, unfortunately. Most textbooks, biology textbook and medical textbook, we don't have this in the textbook, unfortunately. It helps regulate other chemicals or neurotransmitters in the brain and other tissues, participate in homeostasis, and it's a system that keeps the balance. So if you have a take-home message that we need to emphasize here, the endocannabinoid system is a system that everybody has that is designed to respond to internal or external stimulus. Example, it is involved in different physiological processes such as pain. If there is pain, if there is pain, generally there are endorphins, but there's also the endocannabinoids that are going to be increased in the system to help regulate the pain. If you're hungry and you want to eat, the endocannabinoid system or endocannabinoids in hypothalamus are going to increase so that the appetite can be, to increase the appetite so that you can eat. It is involved in memory formation. Very important part of endocannabinoid system, and it is involved as well in pleasure. Do you have a theme song at a college? Do you have a song here or a team, the song that you sing in the stadium or something like that? No? Somebody, anybody wants to have us sing here? No, it doesn't look like. So everybody sings, even those who do not know how to sing. They sing in the shower. So you all sing. You know why? Because when you sing, it increases about the endocannabinoids by about 40%. So same thing when you dance. So endocannabinoids respond to the stimulus. So even the depressed people, when they sing, they feel better, at least temporarily. So there is something that happens when you sing. And part of it, the levels of your endocannabinoids increase by about 40% in that time being. So endocannabinoid system is very important. It's very important. It's involved in stress as well. They have tested people who are stressed. There is something that is stressing you, like you have an exam, or your boyfriend tells you we need to talk, or there is something going on, or you have a presentation like me. The levels of cortisol increases a little bit. The cortisol, which is a stress hormone. And the studies have shown that endocannabinoids follow the curve. When cortisol increases, endocannabinoid increases to try to cool it down. So it is involved in stress as well. Pleasure, pain, motivation, appetite, memory formation, and it is even involved in discriminatory memory. Like you have something that is not really amazing to remember, that is not good to remember, and the cannabinoids are going to participate in trying not to store that memory, while favoring the memories that are wonderful to remember. So, the truth or myth? The presence of the endocannabinoid system in the human body explains why everyone needs cannabis to maintain a healthy balance. Who says yes? Excellent. Who say no? Okay, so it's a myth. It's a myth. The endocannabinoid system is an endogenous system with the necessary autonomy to self-stimulate with its endogenous cannabinoids and receptors. It does not need cannabis to be functional. It's functional since your birthday until you die. You don't need an outside cannabinoid to stimulate the endogenous system. So, myth or reality? But before we get there, so cannabis, if I come back to cannabis, cannabis is going to bind as well to CB1 receptors. It's going to stimulate the receptors from the endocannabinoid system. So it's going to mimic the endocannabinoids. So when you take cannabis, inside the system is going to interpret that as if it's an endocannabinoid, as if it's an anandamide or 2-AG, and it's going to stimulate the system to react to something that is not necessarily there. So when you take too much cannabis for a long period of time, the endogenous or the endocannabinoid system is going to be downregulated. And when there is a stimulation that needs its reaction, it's not going to react appropriately because it's been down-regulated by continuous and heavy and persistent take of outside cannabis. Is that clear? Because this is very important to understand. It's through the endocannabinoid system that cannabis works. So, cannabis is a very predictable drug. Some people say it's all good, it's all miraculous. I remember in Boston once a journalist asks me, I get there and before I even open my mouth, they are like, what do you have to say about this miraculous, all good plant? I'm like, okay, it's going to be a long conversation here. And of course, nothing is all good. Nothing is all miraculous. And as I say before, what we know is always smaller than what we don't know. Others say it's all bad. Nothing good can come out of it. This is all false. Okay? Because cannabis is a mysterious plant. Amazing, surprising, and unpredictable. If somebody comes here in this room with cannabis, and we all take cannabis, okay? Who says we will have the same reaction? Different reactions. Absolutely. So if somebody comes with cannabis here, and we all take it, some will sleep, fall asleep right away. Others will jump in the air, they'll have fun. Others will start to be suspicious. I think you're looking at me, bizarre, I don't like the way you're looking at me. Others will just get confused. And others will have panic attacks. Others will completely be relaxed. And others will feel nothing. But if they come with cocaine, we will probably all be agitated and stimulated. So we can predict more the reaction somebody will have with cocaine than the reaction somebody will have with cannabis. We will completely all have different reactions. That's why it's very unpredictable. Desired effects, relaxation, anxiety reduction, sleep, appetite, sensation of high euphoria, pain control, and some other observable signs for cannabis users. Some people will have red eyes, increased appetite. When you have a friend or boyfriend or a kid or who all of a sudden the appetite increases dramatically. One of the hypotheses is they probably started using cannabis because the appetite really, really goes high. And increased reaction time, that's like when you're driving, the time to react may be longer. And memory can be affected, as I said. And the cannabinoid system is involved in memory formation. So when you take too much cannabis, it's going to affect the hippocampus, especially the working memory can be affected. So remembering dates, organization, or procedures of how to do things. You can have learning difficulties, increased pulse, drop of blood pressure, and sedation or sleepiness.
Quick question. I recently read a study that was trying to link how people who smoke weed regularly have a lower BMI than those who don't.
A lower?
A lower body mass index than those who don't use it regularly. Is that a myth or what? Especially with the
I don't know. I don't see the link between cannabis and the body mass index. I cannot tell. I didn't see the study to be able to analyze it. But Yeah, good question. So this is the brain from 5 years, for a 5-year-old brain to a 20-year-old brain. As you can see, we're talking about the dorsolateral prefrontal cortex. This is the part of your brain that is involved in what we call executive functions, organization, anticipation, planning, and it's developed later in life. You know, it's one of those parts, the prefrontal cortex is one of the parts of the brain that is developed the latest. You know, the brain doesn't finish to develop until you're about 25 years old. And for some people, especially men, it can even go to 32 years old. So it's important to keep that in mind, because when you take cannabis, too much cannabis before your brain has finished to develop, there are studies that show that it can prevent the prefrontal cortex to develop. And this is a crucial part of the brain. It's part of the brain that is involved in all the things I just said, the executive functions. And when it's not working well, it's hard to get far in life. So it is very important to keep in mind the age factor. This is just the brain. This is the limbic system versus the prefrontal cortex. A teenager, limbic system is like a system that is involved in, you know, in emotion, impulsiveness, and how you feel about things, you know, the opinions you have, how strong they are. So it's very well developed in teenagers. Okay? And the prefrontal cortex is not well developed yet. And this is the part of the brain that is telling you to stop. Okay? Hey, I saw something, I saw a drug on the street. I want to take it. Okay? The prefrontal cortex says, hey, wait, it might be dangerous. Oh, there's no car. I feel like speeding up, you know. This is the limbic system saying that. It's telling you it would be fun. It would be fun to accelerate, you know, to speed up. And the prefrontal cortex says, you'll probably get a ticket if you speed up. You'll probably have an accident. So it's not a good idea. So in teenagers, the system that speeds up is well developed. Okay? But the brake is loose, is not well developed. That's one of the explanations why when a young person or a teenagers use cannabis or other substances, is more likely to fall into addiction or dependence, because the brake is not sufficiently developed to tell them, maybe not this time, maybe not again. Maybe you could wait until a week is over before you start again, because you may get addicted. So when we talk about cannabis, for example, you can see, we will see further that, actually we're there. Is cannabis addictive? This is one of the questions I encounter a lot when I'm talking with a journalist and I'm doing conferences. Is cannabis addictive? Absolutely not. Who say absolutely not? Absolutely yes for every user. Nobody? Yes for some people. Oh yeah, you're too good. So I'm not going to go through the neurobiology of addiction today, but we can define addiction or dependence or substance abuse by 3 C's: control, consequences, and craving. The loss of control about the substance. The consequences, social consequences, family consequences, failures in school, or other problems, you know, in the community with the law, and craving. So the 3 C If somebody has this 3C and they are telling you, no, no, I don't have any problem with alcohol, ask them, can you go a month without alcohol? If they say, absolutely, yes, no problem. Okay, let's try it. Oh, no, come on. Let's try it next month. So there's probably a problem by the loss of control and the craving. Is cannabis addictive? So cannabis is going to act on the reward pathways as well. It's going to stimulate the areas involved in the reward system, reward pathways, such as ventral tegmental area, which is going to perceive the stimulus from outside and send the signals to nucleus accumbens and prefrontal cortex, as well as the amygdala and the high hippocampus, and then it's going to dysregulate the system. So cannabis has the ability to stimulate this system and increase the dopamine, which is involved in the brain reward pathways. So yes, cannabis is addictive, and around 10% of cannabis users are going to slide into addiction. And this risk is doubled when we talk about teenagers. As we said, you speed up with no break, so more risk to fall into addiction. About 1 in 6 teenagers who use cannabis have the risk to slide into addiction. For those who use it daily, the risk is even higher. Cannabis and depression. Is cannabis usage a risk factor for developing depression or a treatment for depression? Okay, who said both? Who say the first statement is true? No? The second? All right. Let's see. So low doses. These are studies that were done at the University of McGill University in Montreal. And low doses of synthetic form of THC. THC, you remember, the psychoactive ingredient in cannabis. Low doses of synthetic form of THC have shown an increase in activity of neurons that produce serotonin. Okay? And then the possible antidepressant effect. All right? Then they increased the doses to see what happens, to see if the person will feel even better, or if the system, it was mostly like a biochemical study, to see if the activity of the neurons is even higher. And this is what happened. High doses of the same thing, synthetic form of THC, shown the reduced activity of neurons that produce serotonin, increasing the risk of depression and psychosis. So a little bit of cannabis has shown, we don't have population study or clinical studies to show that. It's mostly biochemical studies. But a little bit of cannabis, increase in serotonin activity. You increase cannabis, reduced serotonin activities. And if we go clinical now, heavy and regular cannabis users are 2 to 4 times more likely to experience depressive symptoms than non-cannabis users. So these are the studies that have been done. We have multiple studies showing the increased risk of depression for heavy cannabis users. I'm in the ER a few days after legalization of cannabis in Canada, and there are 2 young men show up, around 19 years old, and one of the guy refuses to go home. And he suspects his dad to spy on him because he must be a CIA agent. his friend, not knowing what to do, brings him in the ER, and I happened to be on call that day, and he tells me that his friend was just fine, and they took a few joints together, and then he started to panic just about an hour after, and he doesn't understand because they took exactly the same thing. One is completely fine, the other one is completely suspicious that his father is involved in the CIA and spying on him. So what happened to this guy? Psychosis. He was completely psychosis. I evaluated him. We had to hospitalize him. We hospitalized him for about 3 days. You know, after 3 days, he was doing fine. You know, luckily, but he was completely a psychosis. So in the general population, the risk of psychosis is about 3%. For cannabis users, the risk is 2 to 5 times higher. This is the subject, the area of cannabis research that we have more, in which we have very, very significant data. So the link between heavy cannabis usage and psychosis is very well established. So the question usually asked is, does cannabis cause schizophrenia? Most studies support that cannabis triggers schizophrenia for people with underlying vulnerability, and it triggers schizophrenia about 3 years earlier. But it might trigger, there is something we call threshold. I don't know if you know what a threshold is. For example, if somebody has epilepsy, there is a threshold to trigger any disease, actually. So when you are at risk, you have the risk of psychosis, and you accumulate the stressors or the stressing factors, you get to the threshold where it triggers the disease. And cannabis contributes in reaching the threshold. So for some people who are vulnerable to psychosis, but living a good life, healthy life, never took drugs, didn't experience significant stressors in their life, they might never get sick for the entire life. While others who have the same vulnerability, because of the accumulating stressors and in their lives, they get to the point that they trigger the disorder. So it's another thing that you probably heard of is this guy who is very relaxed. 19-year-old in the ER, shows up with the family, girlfriend is there, father, mother, parents, grandparents, they are all there. And I'm wondering, what's going on? Who is the patient? Because the room was filled. And they tell me that this 19-year-old guy who was in the first year of college, finished high school with 95% in everything. First semester in college, he was 93, pretty much everything. Second semester, just after Christmas, everything crashes. 50%, 60%, misses class, they don't understand. So the parents take him to the ER. They think he must be in depression. I see the patient, I see the young man, no depression, check the blood, no thyroid problems, no other problems in the blood. There's no reason why he should be, he should change completely from 1 month to another. And finally, he tells me the only thing that changed in my life, I started using cannabis during the Christmas break. And he went really heavy on cannabis. And he completely lost what we call motivation. So he got what we call anti-motivational syndrome, which is a very common in heavy cannabis users, especially in younger users. So we don't know exactly what explains that, but some of the hypothesis is that there is a reduced dopamine synthesis in striatum. Dopamine is the neurotransmitter that is involved in motivation. So there's a reduced dopamine synthesis in striatum and reduced serotonin activity, as we saw in previous slides with heavy cannabis usage. And myth or reality, cannabis and suicide. There's a study here and a few other studies that show important usage of cannabis in teenagers, especially in teenagers, that was associated with increased risk of suicide even later in adulthood. So we have a group of people in Montreal, who encourage mothers to use cannabis, but studies that we have right now show that cannabis crosses placenta barrier and is present as well in the breastfeeding mother's milk. So the fetal exposure as well is very well known to increase impulsiveness, difficulty of attention, problem solving during the teenage years for the babies whose mother have taken cannabis during the breastfeeding period. Driving, is it dangerous to drive with under cannabis? Yes. Absolutely, 2 to 7 times higher, the risk of accident. When cannabis is combined with alcohol, the risk of getting involved in an accident is 15 times higher compared to sober drivers. So very important not to take cannabis for the next 6 if you plan to drive in the next 6 to 8 hours, or even more if you take it edible. Cannabis smoke is very similar to tobacco smoke. Contrary to what people might say, it's very similar in terms of chemical compounds found in tobacco smoke and cannabis smoke. So possibly even more carcinogens, according to some studies from England. And about 4 to 5 cannabis joints equals to 1 pack of tobacco cigarette. So in terms of health, how it affects your lungs and your circulatory system. This is something you probably never heard of, cannabinoid hyperemesis syndrome. This is something we see more and more in the ER. I call it hot shower marijuana syndrome. So this is the official name is cannabinoid hyperemesis syndrome. It is solely for heavy cannabis users who have been using cannabis for at least 1 to 2 years, who all of a sudden start to develop, cycling vomiting. These are really, really heavy vomiting and nausea, abdominal pain, no diarrhea associated with it, just those 3 symptoms. And in that discomfort, they decide to take a shower, a hot shower, and all of a sudden, the symptoms disappear. Hey. After a few hours, the symptoms come back. They take a shower, a hot shower, or a hot bath. The symptoms disappear. They found something. They take another hot bath, hot shower, and they start taking hot bath, hot shower every now and then. Some people, this is what we call cannabinoid hyperemesis syndrome. It is relieved, it's the triad. It is symptoms, cyclic vomiting, nausea, abdominal pain, associated with long-term and regular cannabis usage, and the symptoms are relieved by hot shower or hot bath. Some people have even went bankrupt because they miss work, because they have to take a shower all the time. And they go to work, they can't find a shower. So they are obsessed by taking a hot bath or a hot shower. So they leave work, they go back home to take a hot bath, hot shower to calm the symptoms, and the electricity bill goes high. They completely lose control of their lives. So this is something we start to see more and more in the ER. And medicinal cannabis, medical marijuana, just quickly, cannabis has been shown to reduce chronic pain, especially for neuropathic pain, okay? A chronic pain due to cancer, we don't have sufficient evidences, but some people have been have benefited from cannabis as well. Chronic pain due to fibromyalgia, no good quality studies. Treatment-resistant epilepsy, as I said, especially the cannabis with CBD, have shown really has been shown to reduce crisis, a conversion crisis for epileptic young patients, especially. Spasm or multiple sclerosis, we have more conclusive evidence for oral cannabis or nabiximols than for smoked cannabis. Nausea and vomiting for cancer and HIV patients, we have conclusive evidence that cannabis helps in this area for these patients. As well for HIV cancer patients with very important reduced appetite, we have very conclusive evidence that it helps. In insomnia, moderate evidence, sleep might improve for a short term, but for a long period of time, it's not very good. It's like alcohol. When you take alcohol, you sleep very well for 4 hours, but after that, it doesn't help at all. So it's, some people say, it helps a lot, but it doesn't help for the long term. Depressive symptoms due to chronic pain, limited data. We don't have enough data to use cannabis to treat those kind of problems. Glaucoma, because cannabis reduces pressure in the eye and in the system, some people say, we can use cannabis to treat glaucoma. No studies at all out there. Anxiety, depression, PTSD, anorexia, limited data, and not recommended in any treatment guidelines. And the treatment, if somebody has cannabis use disorders, there is no medication. That means if somebody has a dependence or an addiction to cannabis, we don't have like any miraculous medication to treat that, but it's really therapy, outpatient or inpatient, rehabilitation centers in your area, specialized therapy for young people exist, like TUMA, treatment for users of marijuana in adolescence. Self-help groups help treat underlying problem. Of course, if there is depression, anxiety, psychotic disorder, ADHD, and somebody is trying to take cannabis to self-treat, which is never a good idea. It's better if it's prescribed or recommended by a professional, your nurse, your doctor. And citizen initiatives like awareness campaign are necessary to help members in the community who might have this problem. Sleep hygiene, this is a recommendation I give to all my patients and all my friends and all. You need to sleep well. Sleeping is the key, to treatment of many potential problems in life. So sleeping well involves try to avoid caffeine after 2 o'clock. Try to avoid screen, television, cell phone, iPads, at least 1 hour before you go to bed. You can train or exercise, but not in the last hour. Try to calm down, read a very boring book before you go to bed. I recommend a biology book now. the budget book of your city, something like that. Very boring. So it's very important to sleep well, to eat well, not eat before the TV or the screen, or before in front of your telephone. Try to be active, at least 30 minutes, 5 days a week, or 45 minutes, 4 days a week. It can be walking, going to the gym, jogging. So it's very important this will keep your brain healthy. It will sharpen your brain. It will increase your energy, physical energy, mental energy. And healthy socialization is very important as well. So in conclusion, again, I go back to my sentence. What we know in science and pretty much in everything is so tiny compared to what we don't know. And this is a key to curiosity and to wanting to learn more. And this is true when it comes to cannabis. This interesting, surprising, intriguing, and unpredictable substance, which is not to be minimized, not to be trivialized, because it can have real and serious potential health risk for some people, but also not to be demonized, because it can have potential benefits for medical users. So more research, more discussions, more seminars, more awareness to be done, because we care. Thank you very much. Yes?
Which is more dangerous for causing accidents? Cannabis alone or alcohol alone?
There are studies that show that it's comparable. Yeah, it's comparable, yeah. We don't really know. Yeah. Any more questions? Yes?
So I have several friends in the area.
Can you speak?
Who've been prescribed medical marijuana for their depression, and others who've been prescribed it for their anxiety and have seen great benefits from it, especially after getting off several like the antipsychotics, antidepressants. But as someone with bipolar disorder, they didn't technically consider me a candidate for it. So why is that so separated?
But for bipolar, I didn't get the bipolar part.
So I have friends who are clinically depressed who have been prescribed medical marijuana for it, and after getting off their prescribed medications have seen great benefits. Same with friends with anxiety. But since I have bipolar disorder, I wasn't considered a candidate. So why does that have such a substitution, especially since until 2017, manic depressive disorder, so depression with high anxiety rates, was reclassified as the bipolar. So why?
Yeah, I think it has to do with the studies. I don't think we have any studies that recommend cannabis for bipolar disorders. And physicians or practitioners are to follow the recommendation or the guidelines that we have. So while it might help, it is not studied well enough to be able to recommend that as a medication. So
And when you refer to high cannabis usage, is that like a time period or is it an amount?
that's a very interesting question, because we don't have really the quantity to say, because it's very different for each person. Some people will take one joint a day and it will be considered, they will feel okay. Some people will take one joint only, like my patient, and they will go psychotic. But when you've been taking cannabis for like a year, it's considered like chronic use. When you're taking cannabis like every day or 3 times a week, yeah, you can say that it's an important usage of cannabis. Some clinicians will say if you take above 3.5 grams per week, but they just it's just based on the clinical experience. It's not necessarily like a study like alcohol. As I say, we are really at the embryonic stage of understanding of this substance.
And I'll process is my last question. So for whenever you use cannabis in conjunction with alcohol, does it usually dull the effects of the cannabis, or is it one of those that's going to hop it up, make you more irritable, more psychotic, more?
Yeah, mostly the sedative effect will be higher. So you will be more sedated, like more sleepy, more down, if I say that, because both substances cause that. But in terms of when it comes to psychosis, we don't have studies that show that taking both increases even higher the risk of psychosis, while it can be logical to say that it might do that because they are both psychoactive substances. And we know that chronic use of alcohol, heavy use of alcohol is problematic. It is associated with anxiety disorders, associated with depressive disorders. So if you combine both, you're probably going to be at a higher risk of depression and anxiety problems.
But with the correlation with the alcohol, is it more likely that you're depressed and anxious when you drink alcohol, that you're using it as a self-medication, or that the alcohol actually causes the depression and anxiety?
Yeah, I think we have studies for both. If you are anxious, a lot of anxious people that we see who have started to use cannabis to treat to use alcohol to treat anxiety, because alcohol is very good for anxiety in the short term. That's why when you're very reserved, you go to the bar, you take one glass and you start jumping, because the anxiety goes down. But the chronic use can result in anxiety problems. But some people start using it to try to treat the anxiety, but it doesn't really treat well the anxiety. It just calms down momentarily, and they are at higher risk of falling dependent to alcohol because it helps them so much that they start using it very frequently. Yeah. Yes?
Well, did you come across some good studies only on CBD itself? Like how CBD itself can help when there's no THC in the
Yeah, actually, we have more and more studies. Again, we are it's minimal, but we have especially case reports and a few studies that show that CBD can help, as I said, for epilepsy, for example, especially for children. We have many cases of children who've been helped by the CBD, and I have few friends, some in Pittsburgh, Boston, who've been using CBD oil, and they said, their arthritis is less painful. We don't have studies necessarily that show that have the link. Yeah, but we have, because CBD has anti-inflammatory properties, so it would be fair to say that it could help in those conditions. And as well as we just said, it's been shown to help in patients with cancer, HIV, who have problems with appetite, but there is THC, a little bit THC there because it's appetite stimulating part. But it's mostly 1% or 2% of THC. It's not like the 20% that we have on the market. So it's completely different when we're talking about medicinal cannabis. Even those that have THC in it, it's not that high that like those that are used for recreational purposes. Yeah,
Thank you.
you're welcome. Yes?
So, chemically, what's the biggest difference between like recreational marijuana that you can like buy off the street and the medical marijuana that you have to be like prescribed? Like, what's the biggest like chemical difference?
Between marijuana that has to be described and
Like prescribed by like a doctor
Mm-hmm.
and what you can like buy off the street.
off the street, yes, you don't necessarily know what you're buying off the street, of course. I don't think the pushers will tell you, you got a 2% of THC and 1% of CBD in the cannabis you take. I think that's the difference. Other than that, cannabis is cannabis.
So
It's the same thing.
medicinal marijuana be considered like organic, like with less pesticides, less
Mm-hmm.
chemical,
Yeah, it's another argument.
You would hope so.
Yeah, it's another argument, actually, yes. Yeah. Mhm. Yes?
In states where recreational marijuana has been
Legalized?
legalized, is there something that controls the type of marijuana that's being sold?
Yeah, there is control agencies that have to make sure that the substance is, or the people, the retailers are selling the substance that is, accepted and according to the law.
It should be more predictable than if you're in a state where it's not legal and you're just buying it on the black market.
Yeah, it's a good argument. Yeah, that's one of the arguments for people who advocate for legalization. But even the states that have legalized, the big part of cannabis is still sold on the street, because those who sell on the street will come to your house, will bring you your cannabis. They develop a certain kind of a relationship that is hard to break, and they make it cheaper so that it can be sold. So still, Canada has legalized for a year, but still more than 70% of cannabis is sold on the market, on the black market. So it's just the 30% that is sold like according to the law. Yeah, even in Colorado, it's been years, but there's still about 30 to 40% of cannabis that is sold on the street. So it's hard to to break. It's like yeah. Anybody else with a question? Yes, just a second.
In the local newspaper today, there was an article about they're pushing, now that they have medical marijuana, they're pushing for recreational. And they had a conference and people came in, experts came in from Colorado, Oregon, the states that have legalized recreational usage. And they didn't go into detail, but there was a comment that when people find out the problems that they're having in these other states, automobile accidents and other things, that the idea of recreational marijuana may not be something that they want to pass the vote on. They're trying to get in Florida to pass a law, and the citizens can vote on it, to legalize recreational marijuana. But in the article, it hinted at some of these states are finding that while the money's flowing in, that they've got some other problems that they're not talking about.
Yeah.
They're going to compare that to like automobile accidents that are coming from overuse of prescription drugs or something regularly available like alcohol. How is that comparing? What are their rates?
Well, that's what they alluded to in the article, but they didn't give any specifics. But I have read where Colorado's having quite a few automobile accidents traced back to marijuana. As they still have it for alcohol and
Yeah.
drugs and things.
Yeah, Yeah, the studies, most studies have shown a slight increase of cannabis, but not that much. But what the studies don't talk about is that when you go deeper in communities, you find out that while for the general population, the increase is 1% or 2%, when you go and look in minorities, the increase is not just 1 or 2%. It's higher. You go in underprivileged or low financial communities, the increase is higher than for the general population. So the vulnerable communities are affected more than the general population. But, you know, it looks better. You just say for the general population, the increase is just 1%. But when you take one group of people, especially those vulnerable, the increase is higher. So sometimes the studies, you have to go deeper and see what it means.
Are you talking about what in states
that have legalized, like, yeah, like studies in Colorado, some studies have shown that. But generally speaking, there was not like a 10% increase in cannabis usage in the states that have legalized. You know, there are other problems, but yeah.
So when you talk about how the plant itself was much different than it is now because we mutant it out somehow, do we exactly know how the plant will look like from not being touched by human at all? Like how much THC and how much CBD it will has in it?
Yeah.
I don't know, in Amazonia or I don't know, wherever.
Yeah, it's a good question. I never, yeah, but.
Right.
Yeah.
We probably don't know.
Yeah, but they were able to.
Right. I'm just wondering, like, what would be the natural thing for
The natural thing.
Yeah.
Back in days, also they mostly used the leaves, less the flower, and in the flower there is more concentration of cannabis. So now they dry that flower and get it high, and and they also have the ability to manipulate the plant so that it can produce more THC, because that's what the buyers want. But would it be 2%? Would it be 4%? I don't know.
I'm curious, as a medical practitioner in the ER, how do you treat a patient who comes in with like cannabis-induced psychosis?
Yeah.
Like these patients you were talking about who thought the CIA were after them. Well, what's the treatment?
First of all, first admission. You don't want them outside in the community. If they refuse to stay, you use the law to keep them at the hospital against their will. Yeah. Second thing, you give them an antipsychotic medication so that they can recover quickly, you know. And usually,
like benzodiazepine or?
No, benzodiazepine is for anxiety. It's for anxiety. You give them like Zyprexa or olanzapine or Risperidone or Abilify or Seroquel, Quetiapine, you know, or of those antipsychotic medication, and you want them to give them a good dose right away so that they can, because you don't want the psychosis to stay longer, because if you're exposed to psychosis longer, it's hurting your brain. It's very dangerous. And some people will say, oh, I was a psychotic just for 3 days, no big deal. But when you have a psychotic episode, you're more likely to have a psychotic disorders or another severe psychiatric condition in 10 years. 50% of people has a toxic psychosis. That's a psychosis induced by the substance. They will have a psychotic disorder in 10 years, 50%. So it's not some young people tend to say, oh, so what's the big deal? It was just one 1 week or 3 days and it was over, but the brain has been affected or traumatized in a way.
Real cannabis, or is that the synthetic marijuana? Like how?
No, real cannabis. Cannabis with high concentration of THC. That's the one that may result in psychosis. As I said, those who use, heavily use cannabis are 2 to 5 times, their risk is 2 to 5 times higher than the general population. You and I, we are all at like a 3%, we have a 3% risk of having a psychosis someday, sometime in our lives. But those with cannabis, the risk is about 15-20%. So it's high.
Percent higher than like the national average.
Yeah, the natural, yeah. So 3 times 2 to 5, yeah.
If CBD can be used to treat like an acute anxiety attack or a person experiencing some psychosis because
Nah.
they're like really high on a potent strain that's high in THC, can you like balance that out by like giving them a dose of CBD?
That's what I heard.
Yeah, but
But
it's not, the CBD is not strong enough to treat psychosis. It protects.
If not the person have a psychosis, but it is something that's coming up and you feel like, okay, I'm stressing out.
Yeah.
CBD help it to level it back.
Yeah, absolutely. That's what was interesting actually in the back in the 70s. The ratio between THC and CBD is not like what we have today. There were more CBD in cannabis back then than we have now. Now they really, manipulated everything so that we have very little. The ratio is completely unbalanced. So it's protective to have a CBD in, even for the people who use recreational cannabis. If they could have a good concentration of CBD, it could be protective against cannabis. But once psychosis has...
From smoking a potent THC joint, they're having a bad reaction, give them a CBD joint.
Just CBD oil or...
Yeah.
Yeah.
It's a...
I mean, they sell the CBD joint too. I mean, they sell a huge dose
huge dose, yeah.
CBD they get,
But according to what we know, it's not strong enough. If somebody is having a panic attack or somebody is already psychotic, not strong enough to taper that down.
not having an enjoyable time.
Yeah, somebody.
Paranoid.
Yeah, a lot of people don't end up in the ER. They just get paranoid. Like this story I had from one of my colleagues, this CEO woman in Montreal, big company, CEO of big company, in her 30s, never took cannabis in her life, never went to the hospital in her life, never had anxiety problem or psychosis problem. His friend, another CEO, decides to have, a fancy evening, chicken, cannabis chicken, and she's there. She eats pretty good, 2 hours later, she starts suspecting everybody in the room. Hey, what did you say? What did you say? So she starts panicking completely. She goes psychotic. And when you look at, the pharmacodynamic and pharmacokinetic of cannabis, when it's edible, the effects kick in like 2 hours later. Exactly 2 hours later, she starts completely going psychotic. The evening ends there. They all take their big cars and drive her to the ER because they didn't know what's going on. And, she's like, okay, my colleague told her, you don't touch cannabis anymore in your life because you're too vulnerable. You're too vulnerable.
To have a negative reaction with an edible compared to like smoking a joint?
Actually, edible, it's a good question. When you take an edible cannabis, THC is metabolized by the liver into 11-hydroxy-THC, and this metabolite is even stronger than the original THC. And when it's taken edible, the effects kick in later, about 2 hours later, but they last 8 to 12 hours. Contrary to when it's smoked, lasts for maximum 6 hours, unless you have really bad reaction. So edible, and people will tend to take more because they don't feel anything. 2 hours is long. Hey, come on! So they keep taking it to try to get the effects, and when it kicks in, phew, yeah, this is what happened to that woman. So it's different. It's different in terms of.
Going back to the CBD, like they were mentioning, I manage a chiropractic office, and we use a lot of CBD products, whether it's transdermal, whether it's the tinctures, and we have seen very positive results from that in comparison to using like just the essential oils and biofreeze when using the ultrasound to bring out bruising for chronic pain, for things like that. But the doctor manage, he is very strict about the processing of CBD, about how a lot of it that's readily available now is mixed with things like butane and so overly processed that it loses the
natural aspect of it.
Yes.
Yeah.
That, how often is it filtered down?
I don't know.
And like all I've heard is butane. I was just curious what else could be mixed with these common tinctures that it wouldn't have the full effect of the CBD.
I don't know. It's not supposed to, but people will try all kinds of things. But generally, they're supposed to have the ingredients, and if there is regulations in the state or in the country, they are supposed to use those well-regulated substances. But I don't know what other things they can mix so that it can lose. Yeah, but some people will sell CBD saying it's pure, but there is a little bit of THC so that people can feel
But is it possible
better.
to have a true CBD that's completely lacking any amount of THC?
I think so. I think so. There is. Sometimes it's very, very insignificant, 0.0 something. So it's considered like zero. There is zero effect in those kind of concentrations. So it can be considered pure CBD in that aspect. Yeah.
Thank you.
Yes,
Thank you. Thanks a lot.
Very nice to meet you.
Yeah, nice to meet you too.